So hi, this is Dr. J. I'm going to be showing you a little bit of a dissection of a fetal pig, and primarily the beginning part I want to show you to orient, and then we'll move into some deeper organs. So this little piggy was in utero and has not breathed air and has not eaten food, so it's quite close to term. We can see the nails are fully formed and there's a nice amount of fur. So it's quite close to birth time for this piggy, but it's still a fetal pig, so there are features of the digestive tract and the cardiovascular tract that will still be fetal in nature. So I'm going to show you how we would start and look at structures and begin to do a dissection. So an incision has been made here in order to inject the piggy with latex, both blue and pink, so that when we go looking at the cardiovascular system, some of those blood vessels will have latex in them and be much easier to see. You can see a little bit of the blue latex here at the umbilical cord, maybe pink. So this is where the umbilical cord was attached to the placenta for this piggy, and this pig is a girl because it does not have any descended testicles, unless it's a boy with no descended testicles, but we'll know when we get inside. So we're going to make an incision down the center of the abdomen. I'm going to try to cut very gently to get just skin coming off here, and then we'll go deeper when we're ready to cut muscle. So we're going to cut around the umbilicus like that and straight down here, and then we're going to actually make and cut along the edge here so that we can peel back the skin and have a look at what's happening underneath. So we'll go like yeah, and we'll try to go as far back towards the vertebral column as we can so we get good visibility. So at that point then we want to be able to pick up the corner of the skin and have a look. So we're always trying to dissect into the fascial plane, meaning fascia, which is the connective tissue that's connecting all the parts of the piggy, will have planes in it where we can be to dissect, and that will give us a good view of what we're doing as we're doing it. So see if I can get into this fascial plane that's just below the skin. Okay, so here we'll just turn a bit to get the light a bit, and when you are dissecting you can use the light shining to kind of see where those fascial planes are, and if you can see through it, it's probably fascia and connective tissue and not a structure. If you can't see through it, then that's when you need to be a little bit more cautious. So once the skin begins to peel back, we can even use a probe, a blunt nose probe, or a pair of scissors, and actually release this fascia without having to cut it with a scalpel, and therefore not risking any damage to the structures underneath. So you can see here's the skin coming back, so that we'll be able to look at what's happening with the muscle underneath. So that's that plane to get into, and we can do it from either end. It doesn't matter, whichever is more convenient at the moment. We'll pick up this corner here and see if we can get a little edge started over here too. Okay. So you can see doing this, I'm using the scissors to cut through the fascia, and I'm pulling back so that I can see where the light is shining. In general, if you can keep your tools parallel to the plane of the tissue, you can do a much better job of avoiding any damage. The piggy skin has muscle very, very close to it, and so we want to try to see if we can see some of that before we peel it back. So here you can see this fascial plane. I'm having a little bit of a hard time with the light here because my hands are making a lot of shadow and I can't see beyond them. Okay, that's better. Make some progress here. Okay. So I hope you can see how the light shines off of the lipids in the fascial tissue here. That's how you know where the plane is. So I'm using a scalpel really for speed. You could use a probe or a pair of scissors and go more slowly and cautiously as needed. You want to keep the flap of the skin as solid as possible because that's how you're going to wrap the piggy up and prevent him or her from drying out while you're working on your dissection at a later date. So you want to keep the skin as much intact as one whole piece as you possibly can as you do this. So you ideally try not to make any holes in the skin so that you won't have that drying out effect. Okay, so if you remember the muscles of the abdomen, the outer layer is known as the outer obliques, and then deep to that is the inner obliques, the internal obliques, the external and internal obliques, and then deep to that is Transversus Abdominis, and that runs in this sort of transverse direction. So in terms of orienting towards the pig, this is the iliac crest up here. So this is the os coxa and the femur, and the knee is sitting actually right in here. So we're going to open up a little bit of this so that we get better visibility here. And there you can see muscle, muscle, more muscle. Coming along here. We'll take the skin all the way back as far as we can here. Give us a nice big flap. So you can see the rib cage here, and we know the diaphragm's running up in there, and here are the muscles of the abdomen. So as we go into the muscle layer, we're going to stay as close to the edge of the rib cage as we can so that we won't impact the diaphragm at the moment, and we'll be able to take back the muscle from just the abdomen. So we'll come along like that, and we'll see how we've done here in terms of depth. So that looks okay. So what we ideally would like to see is we'd like to either come back to the peritoneum or come back to just muscle, and then we can see the peritoneum as we do that. So this looks like layers of muscles. You can see here coming off. And there's still muscle underneath. So here's transversus abdominis, this is internal obliques, here are external obliques coming along there. So we're going to go a little bit deeper, and now you can see we're into the belly of the pig, which means we also have the problem that there could be quite a lot of blood or latex or something that's in the peritoneal cavity as we take that out. So here you can see, I think it looks like there's a fair bit of blood in the peritoneal cavity, which would be entirely expected. And you can see it there. So let's go this way a little bit. Now, the pig has a rather unusual urinary bladder. It's long and thin, and on either side of it are located the two umbilical arteries that bring blood from the heart of the piggy to the umbilical cord for transport to the placenta, where blood is going to be oxygenated and also where nutrients will absorb into the fetal blood. So what we're going to look out for here is those umbilical arteries. So since there's such a lot of blood in this abdomen, what I'm going to do is switch over to a different piggy and come back to this when I've had a chance to clean it up. So, okay, so here's a different fetal pig. He's got a little darker patch around his eye here. This is probably not discoloration, it's probably the color of his fur. This is a male piggy, and you can see in this situation I've actually taken the skin back here already. So there are the two flaps of skin, and here's the layer of muscle. And so this shiny piece here is the peritoneum on the inner surface, and those two arteries I was talking about are located right here. So you've got one umbilical artery there and one umbilical artery there, and this structure in between is the urinary bladder. So these arteries carry blood to the umbilical cord, to the placenta, where it gets oxygenated and gets nutrients, and then when it comes back, it's coming back through the umbilical vein, which is this little vessel here, and that would be connected like that to the liver. So the blood comes back through the umbilical vein and goes straight to this large structure, which is the liver. So I've cut it here so that you can see things. So the liver in this little piggy has been pretty beat up. This should not be the texture of the liver. So here's the texture of the liver. That should be normal. This edge of the liver has been beat up probably during the course of first of all, getting the latex out, and then second of all, in the process of trying to clean it up and do the dissection. So I'm actually going to remove a part of the liver here so that it's not in our way as we're looking. And so this is just a piece so that we can see what we're looking at. So this is all liver, and the liver is sitting inside of a dome made by the diaphragm. So the muscle, the diaphragm is up in here where I have my finger, and you can hopefully get a little bit of a view, I'm not sure, maybe in there. And see, that's all diaphragm in there. So you can see it's really quite domed and quite large. And here you've got liver, and you've got on the inferior surface of the liver, the gallbladder. Now, of course, the piggy has not been using its digestive tract, so it really has not had much use for bile stored in the gallbladder. as yet. So what's in the digestive tract of the fetus, both in humans and in pigs, is something called meconium, which occurs from digested or partially digested amniotic fluid that the pig has been drinking, that the fetus drinks. The spleen in pigs is this long, thin structure, that spleen here I'm folding back. In humans, of course, it's a little rounded structure. And this large sac-like structure is the stomach. And you can see this is the greater curvature of the stomach. The lesser curvature would be in here. The stomach then connects to the duodenum. And what I've done here is opened the stomach so that you can see the inside of the stomach, and also cut through the pyloric sphincter so that you can see the pyloric sphincter. So remember, the pylorus of the stomach is that part of the stomach that's closest to the sphincter. So this is the interior of the stomach moving along like that. And then this here is the sphincter itself. So this is the pyloric sphincter, and hopefully I can get my hands out the way so you can get some light in here and see it. So it's this very strong kind of columns of muscle that can close off the stomach and allow a very controlled emptying of the chyme that's been made in the stomach by liquefying food and mixing it with gastric juices. Coming through the pyloric sphincter will come out very slowly in small amounts at a time, so that it can be easily neutralized by the juices of the pancreas, and so that it can be slowly mixed with the enzymes that come from the pancreas. So remember, the stomach lining has gastric pits, which have parietal cells, and those parietal cells make acid. They make hydrochloric acid. So that chyme leaving the stomach and coming into the duodenum is going to be extremely acidic, as low as pH of 2. And so it needs to be alkalinized as it comes into the duodenum, otherwise it's going to burn the lining of the small intestine. So it needs to be alkalinized, and that is done by the hormone cholecystokinin, stimulating the pancreas to make some bicarbonate into the ducts and through into the duodenum. And that bicarbonate will neutralize the very acidic chyme. Cholecystokinin will also stimulate the opening of the sphincter of Oddi, or the hepatopancreatic sphincter, which allows bile and pancreatic juice to enter the duodenum. I'm going to try to give you a view of the pancreas here. So if you're looking at the pancreas, you see that it has a very different texture to the other organs. This is pancreas lying along here. And it would, in life, be retroperitoneal, means that it would be covered with the peritoneum. So I've actually removed the peritoneum from the pancreas so that you can see it more clearly. But here you can see the kidney, which is still covered by peritoneum. And so that peritoneum covering the kidney, that shiny layer, would also cover the pancreas and part of the duodenum. And then also the rectum as it comes down here. So in pigs, the large intestine is shaped like this, as a spiral, and not as a U the way it is in humans. And it connects, of course, to the small intestine via the ileum. So we can feel here and look for the ileocecal valve, which connects the small intestine, and that would be in here, connecting the small intestine into the large intestine. That part of the large intestine that is on this side of the ileocecal valve is the cecum. So that's all cecum. And here comes the small intestine, connects at the ileocecal valve. This is all colon. This is cecum here. What's inside this large intestine is meconium, and it's the kind of green, slightly slimy substance that comes from amniotic fluid. This will be the first feces of the infant, or piggy as the case may be, is this meconium. So that's the colon here. And then let's take a look at the small intestine. So remember jejunum and ileum, and they are organized via a system of peritoneal structures known as mesentery proper. So this is the mesentery proper. It looks like that. It has blood vessels coming and going from the small intestine, which is here. So I'll try to just get a piece out so you can see what that looks like with blood vessels coming and going. So right there, you can see that's the, hopefully you can see, this is small intestine here, and this is mesentery proper. And so although it looks a bit jumbled, actually the small intestine is highly organized by these mesenteries and is not just randomly sitting in the peritoneal cavity. It's an organized structure, and it's packed quite carefully. You can see mesenteries proper there. And the point at which the ileum becomes jejunum, or the jejunum becomes ileum, is really not clear in gross anatomy. You need to be able to see inside the small intestinal wall to be able to see where that transition occurs. The duodenum is much clearer, because the duodenum is that C-shaped structure that leaves off of the stomach and continues as jejunum. Okay, so other things we can look at in here are going to be things like the hepatic portal vein, which we'll dissect out, and then also the vena cava and other blood vessels that we'll be able to see at some point in here. So thank you so much. I'm going to stop with that for the moment. And I'll carefully close the muscle and the skin of the piggy so that it keeps it moist and more or less in good shape until we're ready to go a bit further.